that they can use to create their own jobs or get employed. Dubbed as New Generation Healing and Empowerment Center for Teenage Mothers, the center is funded by the Keystone Community Church of Michigan, USA, to skill young mothers. During the graduation ceremony held over the weekend at the school located in Abendo Division, Nebi Municipality, Dr. Betty Udongo, the Managing Director, New Generation Healing and Empowerment Center, said teenage mothers need economic empowerment if they are to get out of the trauma they suffered during this moment. She added that many young girls whose future was ruined during the COVID-19 lockdown are not able to get back on their feet because they come from poor families.
We opened this center 2 years ago when we had the crisis of COVID and lockdown, and most of our girls got pregnant and didn't have any hope of going back to school. So we opened New Generation as a second chance education for these girls. And so we introduced an accelerated program where those who dropped out in P5, 6, and 7 were given an accelerated learning, and they sat for primary education. And the first group passed, and now they are in secondary. So today is our second graduation.
Meanwhile, Owashi Mildred, 19 years of age, a total orphan, and one of the beneficiaries of the Empowerment Center, said she got pregnant at the age of 16. Owashi was graduated in a short course in hairdressing, said she is now able to buy her baby items like soap, milk, and food, and even pay medical bills of her child.
Let God help you in everything you are doing. Maybe even in every situation, God will help you. Don't be afraid of everything you are doing. Be okay. Let God help you in everything you are doing. Put God first. If you pray, if you let God be your master, God will help you. God will do everything for you. Everything you will find possible. With God, nothing is impossible. Here we learn skills like catering, tailoring, hairdressing, computer, everything, art and craft, PE, everything is okay for us here.
Grace Quatsi, one of the donors, said teenage mothers who got pregnant before they attained primary 7 will be enrolled under the program Accelerated Study to allow them to complete such that they join secondary school.
I am with Keystone Church and the Global Missions Team, and we are partnering with Dr. Betty in the New Generation Center here. We are so blessed and so thrilled to be working with Betty.
And righteousness in Christ. So we Zoom with them every Wednesday morning from America. My friend Wendy and I meet with them, and we talk with them, and we guide them in God's Word and in His ways. And they bring some issues to us, and we help them through some of the problems alongside our partners here who do a phenomenal job of that already. So we are super proud of what they've accomplished today, and we are so excited to celebrate all of their hard work and achievements, but especially the hard work that the Holy Spirit has done in their hearts to set them free from captivity and to be alive and free in
the teenage mothers graduated in design short courses like hair plating, dressing, sandal making, tailoring, reusable pads making, and catering, all geared at giving skills to our girls, adding that they will be able to create their own jobs after training. This highlights the transformative power of skills training for teenage mothers to inspire others. Alfred Jawok, West Nile TV, Nilecast.
Following the concern over the rise of school dropout rates of learners in the region, Terego District has come up with an initiative to eradicate the vice. Take a look.
As the level of secondary girl child education continues to be low in Terego District, leaving majority of the stakeholders alarming, Uriama Self-Empowerment Foundation, a young local non-governmental organization established in 2021 within Terego District in collaboration with the other partners, on 16th of November 2024, organized the inaugural charity run to fundraise and support access to secondary education for girls in Terego District. Different stakeholders, such as politicians, local government authorities, religious leaders, local community members, among others, poured in numbers for the sporting event to extend their support. Father Godfrey Alonzi, chairman of Uriama Self-Empowerment Foundation, Yusuf says they will continue to knock the doors of any supporter who is willing to extend his or her support towards this brilliant initiative.
So I'll continue knocking at the doors of any person who is ready to support us. For me, I will play my neutral role. I'm a community leader and more so a religious leader. So we want to make sure USEF remains a neutral organization so that we can attract more people, so that we can support more people without any kind of bias. We request God Almighty to bless our intentions and to bless our activities.
Sidalen, mentor runner of the day, encourages the girls to make use of this initiative, more so urging parents not to look at their girls as source of income.
Today, USEF has brought it. Work hard, pass your exams, and see what you can do in yourself. And then it goes back to the parents. I want us to support our children. Doesn't mean that if you look at a girl, you look at this girl as a source of income. No, it should stop.
She further encourages the various stakeholders to support the girls in terms of sports, since sports of late is source of income.
So if also we support these girls in terms of sports, they can be great people. Because nowadays sports is source of income, and we need to support them and show what kind of things they can do rightly to achieve all that.
Andrew Dennis Patrick, Teregu District Sports Officer, says resource envelope is one of the key challenges when it comes to educating girl child. Therefore, urges parents to strategize in that.
Economic factors are a primary reason for girls dropping out of school. Like at home, if you have boy child and girl child, they all enroll to school. But in case finances do not allow those two to be supported in schools, the first victim is girls. And with that, I'm urging the parents, the stakeholders, let us take girl child education serious.
Emokolo Nyango, Deputy Resident District Commissioner Teregu, calls for unity among the public and urges people to embrace government programs to minimize some of the challenges of girl child education.
If we want to succeed in the girl child education, we need unity. Unity in our homes, because that's where we start getting problems. So this is what I want to call upon you at family level, at the village level, at sub-county level, at district level, to maintain unity. The issue of government programs. I want you, people who are seated here listening, to look at it. If we really take on all these programs which government is bringing in our area, and we be keen with it, you will see that these programs are normally targeted to eliminate such issues we are addressing of the girl child not going to school in our area.
Maro Bigakania, State Minister for Land and Urban Development, who doubled as the chief guest during the event, says he will continue to extend his support for the organization, but urges the stakeholders not to mix it with politics.
I want to promise to you I'm going to support this organization whenever I can, because I've ever supported the others. My appeal is like somebody said here. Politics is now coming. You make sure you leave this organization out of politics. Leave this organization out of politics. I promise you I'm not going to bring it, say it must campaign for me. It must not campaign for anybody. It must do things transparently so that we're able to grow our people. And if we see anything wrong, we must point it out. What is the status of PDM now? That's the best way for us to support government and support our people.
This is the first of its kind. The organization is empowering girl child through charity run. Therefore, it shall be an annual activity, and every year 14 best performed girls across different primary schools shall be picked from each of the 7 sub-counties in the district to benefit out of this initiative to attain secondary education. Oraku Benson Pastore, West Nile Television, Nile Cast.
More in our stories. As threats from Mpox disease keep hitting onto the country, the Ministry of Health, in partnership with ACME and partners, engage journalists from Arua City on reporting about health emergencies. Take a look.
Since journalists are found to have encountered numerous challenges in reporting health emergency stories, such as handling Mpox-related issues, Ministry of Health, in collaboration with other partners, such as Africa Center for Media Excellency, World Health Organization, United Nations International Children's Emergency Fund in Arua City on Monday, 18th of November 2024, organized a forum sensitizing the journalists on dealing with health emergency stories, more especially reporting on Mpox, which continues to hit the nation. Dr. Edward Muganga, a representative of World Health Organization, urges journalists to avoid stigma reporting.
There are people who run out from their villages, homes. They can't settle in other districts. Why? Because of stigma. Currently, as a ministry, we are doing research on the survivors of Ebola in Kasanda and in Obende. Some people actually moved away from those areas to other districts. Why? Because of stigma. So how can we embrace this? How can we, in our reporting, how can we empower a survivor to remain in the village, to remain in that municipality or city? The role of the media in public health emergencies. This one is a standalone component which all of us should be focused on.
Anton Bugembe, Communication Officer for World Health Organization, encourages journalists to have community engagements with local community members.
We realize that of recent, we have an increase in community transmissions. These are mainly among sexual partners. So this means that we need to have a lot of community engagement to address this. And then also we need to have research. As WHO, our immediate goal is to prevent Mpox from reaching vulnerable populations and manage it. We know that we can use the media to dispel rumors, to address stigma, because we realize that stigma is a big problem when it comes to Mpox. A lot of people who are living with Mpox or who have survived Mpox meet challenges getting back into the communities. So we believe that from your reporting, you can be able to instill the public confidence, one in the health system, but also to allow the survivors to get back into their communities.
Aiko Stanley, an officer for United Nations International Children Emergency Fund, a regional office similarly encourages the journalists to approach focal personnel in order to get the right information about Mpox.
One of your key role is, of course, now participate during these meetings. That's where you're going to get facts concerning where this disease is currently occurring, how many people are confirmed in various districts or in which facility. Even at health facility, you can get some facts because these confirmed cases are admitted in isolation units. So there also there is a focal person where you can get some facts. Even at the community level, they are trained health personnel that we call village health teams, who are trained to do community-based surveillance. So of course, sometimes they don't communicate directly to you, but of course, you can easily see the work they do as far as Mpox response is concerned.
Meanwhile, Zaira Namuli, trainer with the Arua Center for Media Excellency, who doubles as the communication officer for Lang Institute in Mulago, says, as a journalist, you still consider the privacy of a patient when reporting about Mpox.
Respecting patient privacy. As a reporter, you'll always be excited when you have this tip. You've been told that the patient is here in Ward 1, so you run with your gadgets, you're saying the name of the person, where they stay. where they are renting and all those things, it is not necessary. Because at the end of the day, so what? Okay? You may think you have done a very good job, but what if it was you? What happens when this person cures and the mpox disease is not being talked about 20 years later? To communicate effectively, we have to be able to look at those things, credible sources, simplify jargons, and promote prevention measures. Don't report to scare.
In Uganda, over 500 cases across 34 districts countrywide have been registered with one death report. In July 2024, the cases increased by 8.8%, with age bracket between 20 to 29 being mostly affected. Oraku Benson Pastore, West Nile Television Nilecast.
More in our stories, Yumbe Regional Referral Hospital commemorated International World Prematurity Day with the different stakeholders themed Access to Quality Care Unit. Take a look.
Yumbe Regional Referral Hospital commemorates International World Prematurity Day, being one of the iconic health facilities in West Nile region when it comes to neonatal intensive care unit health services. On 19th of November 2024, different stakeholders, such as health personnel from different health facilities across the region, government officials, community members, among others, under the theme of Access to Quality Care Unity, poured in numbers at the hospital premises, sharing their experiences and laying strategies on what best can be done to minimize the cases of premature newborn babies in the region. Dr. Margaret Nakaketo, Chairperson Newborn Steering Committee West Nile Region, says public should not focus much on the causes, but rather lay strategies on what should be done once it happens.
We cannot say that maybe the mother has a fault, how does the prematurity occur, but that is not the problem. The problem is when they come out, what do we do? Before, our babies were dying nationwide because we did not have facilities like this one everywhere, and we are starting. Me as Margaret, I made West Nile as my learning hub. So we have established this, and we build a system, and then we shall see how things are moving on.
Dr. Mubarak Nasuru, Deputy Hospital Director, Yumbe Regional Referral Hospital, highlights on some of the statistics of the premature newborn babies they take care of. Also thank the government and other partners for the brilliant initiative.
Our admissions range between 80 and 100 per month. So some days we get about 5, 3, or it ranges between 5 and 7. We want to thank the government through the Ministry of Health for this, and also a number of partners that have supported in our trainings. So we are very grateful for what we continue to get from this facility.
He further highlights on some of the challenges they encounter in the system.
Sometimes some of the medicines, because what we are given as a hospital is based on the national population, and yet our place serves both refugees and the nationals. And being a place facility near the international border, we also get people from South Sudan and DR Congo. So what we are given sometimes runs out. The other thing is, as a facility, because there are also cases sometimes that are beyond this facility that need a referral, and we only have one ambulance, so those ones sometimes take longer. But we've worked together with the other partners to support this problem. But supplies, and sometimes the power has been fluctuating because it goes on and off, and you see these babies survive on those, and that has been the other challenge we've been facing.
Aisa Jacqueline, mother of triplets from Arumaji village, Koboko district, shares her experience on Nichu and management of triplets, therefore seeking for support.
So I gave birth at 7 months with them. One was at, the first triplet was at 1.5 kgs, then the second was at 1.4, the last one was at 1.3. They have disturbed me, but reaching at the first 8 months, the past 8 months, now they are okay. We are put in Nichu. When they were in Nichu, we stayed there. Conversion was with them, so they treated them from there. I've been moving. When I'm discharged home from Nicho, I can stay only for 2 days. You find sickness coming again to them, I go back to Nicho. Right now, the first one is at 9.8, then the two are at 8.6. There is no support that I'm getting. I really wanted the support, but I didn't come across any.
Meanwhile, Dr. Patrick Odongo, Hospital Director for Yumbe Regional Referral Hospital, calls upon government to increase the staffing level in relation to the improving structures.
With the improvement of the structure, it meant the staffing level dropped drastically. And our target is if government can progressively, maybe annually, keep giving us more wage, and we reach about 65%, that would be great.
Vuyayavuni Matthew, Deputy Resident District Commissioner Yumbe District, urges government to train more health personnel.
My advice there would be to train more and more of these health workers so that they work on schedule and have enough time to rest. Because you see, a health worker is a professional. And but these health workers, before they are given their certificates, swear to the Almighty God that they are going to do their best to serve human life. Now with the public, we should be able to guide and counsel the public so that they realize the predisposing factors and the precipitating factors.
Statistically, Yumbe Regional Referral Hospital registers over 900 cases of premature newborn babies annually, with a 95% survival rate and only 5% death rate. The least newborn baby who survived weighed 800 grams, and all these are attributed to the better health services offered at neonatal intensive care unit of the hospital. Oraku Benson Pastore, West Nile Television Nilecast.
Moving on to Moyo District, over 170 units of blood was donated during a blood donation drive in Moyo District with six successful surgeries at Moyo General Hospital. Take a look.
The blood donation drive, together with the plastic surgery camp, was organized by Moyo General Hospital in partnership with Pipeline Worldwide, a non-government organization based in the United States, aimed at increasing the units of blood being donated within the district. Bessie Bernard, the hospital administrator, Moyo General Hospital, gave details of the number of blood units donated during the drive and the number of plastic surgeries conducted.
Donation event exercise was very successful. About 178 units of blood was donated, and the plastic surgery is also a huge success. By the end of the day, 6 very complicated plastic surgeries would have been accomplished. But for me, the biggest achievement is a beginning of a relationship, a working relationship between Moyo Hospital and Ohana 1, the surgical team that is carrying out the surgical camp, with the emphasis on training, transfer of skills, using technology known as the smart class.
Jamie Nolet, the co-founder Pipeline Worldwide, said they have realized that Moyo General Hospital relies on blood that comes from Arua, and in most cases the units of blood they get is not sustainable, yet they use the ambulance which is supposed to serve the people within the district, and that explains why they, together with the hospital, decided to organize the blood donation drive so as to increase the number of units of blood being donated from within the district.
The issue with that is there's a couple problems. One is when they go to Arua to get the blood, they have to take an ambulance, and if an ambulance is traveling, then it's not here to be available for people who have an emergency. And so the need to have the ambulance stay in Moyo is very important. And the second reason is, Arua only has so much blood they can give. And so when they go there, they can only give so much. But if they're able to collect more from people in Moyo, there'll be more available for them. And so it's really going to have tremendous impact on the Moyo community, both from hoping having the ambulance, still be available, and then also having the ability to get more blood, which is needed at the hospital.
Dr. Jeff Smith, a doctor with Pipeline Worldwide, said Pipeline Worldwide has been working with the people in Moyo for a very long time, but they intend to bring the medical team at the facility more often so as to provide quality services to the public.
So this is the first time that we brought a medical team here to Moyo. We've worked closely with the hospital before on other projects, but we will be doing a couple of operations on patients who can benefit from this type of surgery. We hope that this is one of many trips with medical teams, and so Pipeline itself usually comes here twice a year and brings groups. In the past, we've brought neonatologists who specialize in caring for babies right after they're born. We've brought obstetricians and gynecologists to help teach about how to prevent postpartum hemorrhage and care for women after childbirth. And this is our first surgical team. So yes, we hope to continue to bring medical professionals back here year after year.
Madroa Elizios, the Focal Point Passion Uganda Red Cross Society Moyo branch, lauded Pipeline Worldwide for taking up the initiative to organize this blood donation drive, saying, "For long the district has been lacking such drives and urged the public to donate blood so as to save lives."
And this had been something which we had ever been, aspiring for. Blood is very, very, very paramount, and we really needed blood. And Moyo people in Moyo, we had been encouraging, but at least at the last, people are at least speaking, and that is what we really need to encourage people down there to come up.
Unziku Benjamin Waigo, a donor, said he donates to save the lives of mothers and those who lack blood due to accidents, and appeals to the public to share the blood with those who lack so as to save their lives.
Why I donate is because there are so many people who need blood. Our hospital, particularly the mothers, when you go to attend to what, there are a number of mothers who come, they need a lot of blood. We have a lot of accidents on the road. These people need blood. Just this morning, as I was coming here, I got someone who had an accident, and definitely this person will need blood. Therefore, for me, this is an opportunity that people have come. I have to give the blood to save such people.
For a very long time, the health workers have been grappling with the challenge of lack of blood at the facility, which they attribute to the negative attitude of the public in the district towards blood donation, which in most cases made the hospital depend on blood from Arua, which in most cases comes in few quantities. It's from this ground that Pipeline Worldwide, together with Moyo General Hospital, organized the drive so as to help boost blood donation within the district. Dominic Anthony Okumu, West Nile TV, Nile Cast.
And more in our stories, Uganda Girl Guides Association has been launched in the West Nile region, particularly in Arua, Greater Arua and Yumbe district, to address the challenges of school dropout rate. Take a look.
Because the future of children in West Nile region in education sector continues to hit much negativity in terms of school dropout rate, Uganda Girl Guides Association, that molds women and girls who care and contribute to the society, has finally been launched in West Nile region, particularly in Greater Arua and Yumbe, witnessed by different stakeholders to address some of the challenges. For Irene, project assistant for Uganda Girl Guides Association, highlights the public with what the organization is all about.
Saying the Uganda Girl Guides Association is a voluntary organization which is dedicated to the growth and development of girls and women. All girls and women are valued to take action to change the world. All, whether with disability, whether with what, we value all girls and support them to change the world. Our programs are in schools and communities, but they are non-formal activities.
At Urinde Mpwairo Prudence, project coordinator says they are looking forward at issues that affects women and young girls in the region, basically in the sector of education.
basically focuses on advocacy, leadership development, education, and community engagements. What are we advocating for? What are we educating people about? What are we engaging communities in? As she said previously, we are looking at issues that are affecting girls and young women in the communities where we are. Here in Arua, in Yumbe, in Kumi, in over 113 districts in the country in which we are operating. If you look at the statistics, you can see that very many children enroll for P1, P2, P3. But by the time they complete P7, out of the thousands that enrolled, only 21 are city BLE, meaning there is a problem. So Uganda Girl Guides Association has come in to see how we can reduce on that challenge of school dropouts. We've realized there are high school dropout rates which are driven by poverty. We have early pregnancies and early marriages. I got to learn that in this region, people value wealth so much, and they look at girls as a form of wealth. But our girls need to complete school.
Alekwa Jafari, Councillor Teluk Barakari, who doubles as a senior retired head teacher, says it is the role of community to guide these learners in informal education to provide linkage with formal education.
It is you, the community, that must really guide your children from the foundation, that is in formal education, to link up so that you have an effective education.
He further encourages parents to embrace food production to minimize the level of poverty.
The economic position of these majority parents includes production of food. Production of food. That means we, the stakeholders, must deliberately invest in production of food, which will reduce the magnitude of poverty in the majority areas.
Dramati David, Inspector of Schools and Acting District Education Officer, Rue District, says this initiative will have positive impact in improving the status of the schools in relation to the school dropouts.
This intervention by Girl Guide Association will improve the status in our schools. One, we are going to encourage all the school stakeholders to be accountable for every learner in the school. The situation in the ground in the past years has not been good, but not in all schools, but some schools are trying their level best really to improve the situation because they have functional school management committees. We have very few schools where we have high dropout rates in our district.
Uganda Girl Guides Association operates in over 113 districts of Uganda with a total membership of over 436 members from the age of 3 onwards. In West Nile, it runs in Yumbe district and Greater Arua with a period of 2 years. Oraku Benson Pastore, West Nile Television Nilecast.
And more in our stories. Retired Major Mahmoud Ramadan Lembe is hoping to get support in form of compensation for his veteran efforts towards serving his country. Take a look.
As the government of Uganda recently embarked on a move to have the veterans in the country compensated for their efforts, 84-year-old retired Major Mahmoud Ramadan Lembe is among the scores in West Nile sub-region hoping to get the support. Lembe, a resident of Gotri village in Odonga Town Council in Ibe district, joined the army in 1960 as a member of East African Rifle Front, later joining several fighting groups in the region, before becoming the commander of the National Army West Nile Front, supporting President Museveni's Bush Road struggle from 1983, leading over 1,700 soldiers. In an interview at his home recently, the sickly and aged retired major acknowledges that at the time of his retirement in 1995, several pledges upon his request were made by the government as a token of appreciation, which, however, have remained on paper up to date.
Mother retire.
At the time of my retirement in 1995, I was asked on what I wanted. I requested for bus, tractor and money which amounts in my file, which the government agreed to give me.
Azila trakita. Azido sende. Senziba. Kisabu kido. Modify legadi.
Lambe therefore asked the government to fulfill the pledges while he's still alive because of his elderly and sickly conditions.
Madidri.
I am still alive. I'm also weak at the same time. I'm therefore appealing to government to give me these pledges. Additionally, as the government recently embarked on the process to have the veterans in the region compensated, Lambe's name appeared with the UNRF group, which he feels unhappy of.
Can say Muse is the founder of UNRF because he first formed a voluntary group. They were fighting as volunteers. Then when he was advised by Padre, he invited UNRF to come under him. So when these people came, as he had said, they started also internal fighting. So when they started internal fighting, that's when Muse moved out. So that's why his name has appeared there. He was a member there. But as a commander or leader to NRA West Nile Front, he cannot go to benefit there according to him because he has people who are under him now under NRA.
Meanwhile, Saidi Lambe, one of the sons to the retired major, who helps him as the personal secretary, is asking the government to fulfill the pledges due to the difficult conditions.
Muze's health condition is not good because in 1979, that war, Muse was shot in Soroti with RPG. So in his body there are still particles of that bomb. That's why he's experiencing back pain. If you check him behind there, you see there are particles of fragments, his knees, mostly his joints, there are fragments there, maybe which needs to be operated to be removed. That's why his health is not okay. And he is suffering from asthma. Asthma is an effect of too much coldness. And I believe that coldness he was when he was working for the government of Uganda. So Muze's issue is issue of Uganda. It's not issue of one person.
Salim Kumakech, the Arua City Commissioner to piece the delays to the process involved in the verification exercise by the Ministry of Defense and Veteran Affairs. Salim, however, implored the family to remain calm as they pursue demanding for their benefits from the government.
I want to encourage him. He should not be annoyed that his benefits have delayed. Yes, we really appreciate that it could have delayed for one reason or the other. The reason can be either on his part or even on part of the processes that government undertake. So I would want to ask for patience from him.
Lambe is still suffering from the injuries incurred while in active force and hopes to receive the funds in future in appreciation for his contributions in the liberation of the country. Farish Majid, reporting for West Nile TV, Nalcast.